Chapter 13, we get into talking about evaluation. Now, as stated here on the slide, it is an overview and just try to get you thinking about some things to consider um, as you're, coming up with an evaluation plan. This isn't a comprehensive discussion about evaluation. That'll come in my other class, HSC 6115. But I can give you the salient points that really drive what your evaluation plan is going to look like. Okay, so what is the purpose of evaluation? Well, the purpose is to show how your program is performing according to your expectations. So if you take that general kind of definition of evaluation, you can see that it applies to very comprehensive program plans, but it can also be applied to the more simple program plans that you may come up with, right? So again, going back to the purpose of, okay, so you're saying that we need to do this regardless of the size and scope of the program. Why? Well, assessing and improving quality. So what we're talking about here mostly is the quality of your program plan, right? So you identified this problem and you've come up with a solution in the form of your program. Now, does that plan adequately address the problem, right? Are there enough steps? Are there enough considerations in that plan to address that defining problem? So we can look at evaluation from that perspective to, assess, is this a quality program that, the expectation is that you will address the problem that you set out to come up with a solution for. And two, determining program effectiveness. Okay, so if it is adequate, or if it is your program plan is adequately designed to address the problem, how effective was that plan at addressing the problem? So program evaluation can help us address or look at these two things. And it's program evaluation is so important that NCHEC considers it one of the areas of responsibility for a certified health education specialist, right? It's area 4. So again, as we're determining, right, the value of our program at addressing the particular need, well, we're going to set up expectations in the form of predetermined criteria or standards of acceptability identified by stakeholders. Basically, your stakeholders are those individuals that have a vested interest in improving the situation for the community that you're working with. And they may have their standards or their expectations of what you're being brought in to do programmatically. In addition, evaluation is built upon your measurable objectives. So we're trying to create a situation where we have a clear understanding of what we are evaluating based on all parties involved. Okay, continuing on with the terminology. So formative evaluation. So this is kind of an umbrella term referring to the different types of evaluation: process, impact, outcome. But with formative evaluation, these would be any evaluation considerations you make prior to implementation and during implementation. And technically, I guess it would extend until the program implementation ends. But really what we're interested in evaluating happens during implementation. We typically don't wait until the end. So of the types of evaluation that we've covered previously, of course, process evaluation. So here we're really interested in program fidelity. Okay, you've heard this before, but you've planned out your program, and process evaluation simply assesses, did you follow that plan? Now, if we go down here to the bottom, the book suggests that formative and process evaluations used interchangeably. Um, I would prefer to keep them separate. Use formative evaluation again as an umbrella term, and just recognize that process evaluation occurs within the formative evaluation period. Summative evaluation would be the partner umbrella term, right? So if formative evaluation occurs prior to and during implementation, summative evaluation is going to occur once the program ends and extends out some period of time. Typically, you use this to measure your long-term objectives. Usually it's going to be a health status change. So if you wanted to decrease, we'll say BMI, well, it just takes time for the physiology to work that results in a change in weight. If we're talking about changing from a health status, some condition to a lesser condition or absence of condition, again, that's going to take time. Now, impact evaluation, again, this is really going to apply to your learning objectives, your behavioral objectives, that type of thing, environmental objectives, things that are occurring. So when I say occurring, I'm referring to the by-whens of the objective statements. When we reach those by-whens and they terminate within the program implementation period, that's what we're looking at. Outcome evaluation, those are going to be your long-term objectives. Okay, so again, the book kind of infers that if we go down here to the bottom, impact and outcome evaluation together constitute summative evaluation. Well, it depends. Like I said, some impact objectives, you're going to meet those early on in the program implementation, maybe intermediate steps, or maybe closer to the end. But if they occur within the program implementation time frame, then that's what makes them formative. If they extend beyond the end of the program, then we would consider those summative. I mean, here's a graphic that kind of catches that. So formative evaluation, you see it includes the planning stages. So while you're kind of putting these together, if you have any kind of pilot testing, that would certainly be formative. If you have process and impact evaluations that occur, well, the impact evaluations, their by-whens occur during program implementation, then we would shift them over to formative. Summative, it starts at the end of the program and extends out to some predetermined time that you've come up with. Typically outcome objectives fall within that, and I suppose you could have some really long-term impact objectives, or your by-whens are long-term. That's what determines the summative or formative. Okay, and you can read along in the book to kind of give you a little bit more detail, but I'll just kind of summarize the different things that we look at through the evaluation lens. Okay, so start off to determine achievement of objectives related to improved health status. So again, we came up with measurable objectives, right? And well, now the time has come for us to start evaluating them. And evaluation in this case means, have we met the objectives as far as meeting our expectations? Two, to improve program implementation. Okay, so here we're looking at our process objectives, making sure that we're following the plan. If we're not, right, hopefully we have some time to kind of make some tweaks and to get back on track. Provide accountability to funders, the community stakeholders. Again, to demonstrate that our program is effective, that our program is working towards reaching our established goal, to increase community support for initiatives. Again, having a demonstratable program, or a program that demonstrates success at doing what it's intended to do, uh, when it makes it for an easier sell to the community to get them to support, i.e., participate in different programs. Contribute to the scientific base for community public health interventions. This all goes back to utilizing evidence-based approaches. So your evaluation, that's going to be a quantifiable evaluation that you could, again, that's going to be your evidence, right? Here's what worked, here's what didn't, here's the extent of how it worked, that sort of thing. To inform policy decisions, again, evidence-based. Say, look, here's what we found, right? If a person is deliberating, whether or not to pass certain policies or to develop certain policies, we can say, well, here's how these variables interacted within this particular program. This may be an indication of what the policy would be able to achieve. So here's a framework, evaluation framework developed by the CDC. Remember, I'm using the term framework, so it's kind of guidelines. But it says, the steps in program evaluation, you begin with engaging your stakeholders. These are individuals who have vested interest and to some extent who you're answering to. So identifying who the stakeholders are, getting them interested in kind of your program idea, and kind of getting them involved with what it is you're trying to do. Describing the program. Again, you should have a clear understanding of what this program hopes to achieve, and how it's, a general sense of how it's going to work, so you can come up with this description. Focus on the evaluation design. Once you have kind of a plan, that or a program design plan, that's really what's going to dictate what your evaluation plan looks at, because as you're putting together this program framework, you're going to be developing your measurable objectives, and that's going to be the bulk of what you're evaluating. Gather credible evidence. Again, this is going to be your data. Justify your conclusions, right? So there's always going to be some interpretation involved when you're analyzing the results, and you just want to be able to provide some support for why you interpreted the results the way that you did. Ensure use and share lessons learned. Again, the whole point of doing these programs is to develop evidence to show what works and what doesn't. Now, we're not going to be answer once and for all, here's what works and here's what doesn't, but we can contribute to kind of what's already understood about the situation that we're dealing with. So again, here are the steps from that CDC framework. So engaging the stakeholders. So who are the stakeholders? You have to begin there by identifying who has that vested interest. 3 types of stakeholders. Okay, so one, those involved in program operations. So people that are, again, involved with implementing the program, developing the program, they're going to have an interest in this particular outcome. Those served or affected, so your target population, your priority population, certainly they're going to be stakeholders. And primary users of the evaluation results. Typically, they'll probably be the people that are providing the funding. They want to see some return on investment. Evaluation helps you to establish that return on investment. So the evaluation probably has a different meaning to the various groups of stakeholders, and you need to be cognizant of that. You have to be able to emphasize particular results that align with the interest of the particular stakeholder group that you're working with. Okay, describing the program. People that are stakeholders may not be, that familiar with program design. So, it's up to you to be able to relay, how this program, how it works to improve the situation with the target population or the priority population. Here's where your mission statement, your goal statement, your objectives, these are things that, again, you may have to, show how these things work together to achieve the outcomes that, everybody's interested in. And at the bottom, mention the logic model. That's one of the utilities of the logic model, is to explain the entire program in a very simplified graphic. It's beneficial to you as the program designer because you're able to see all the elements of the program to make sure that they're present. But it's also a useful tool at explaining how a program works to someone that's not familiar with program design. Okay, focusing the evaluation design. So your stakeholders, they have a vested interest. They're probably going to, want to see the results. They want to see this program be successful. So you have to come up with an evaluation design that not only informs you as the designer, right, and the person that is interested in achieving those incremental steps towards the goal, but also you may need to present results in a way that stakeholders can see the value of those results. Okay, gathering credible evidence. Really, this has to do with data collection, right? So once you come up with your measurable objectives, that's going to contain your independent and dependent variables. So now you need to think about, okay, well, how am I going to get the data into those variables, and how am I going to analyze those? So you want to make sure that the data that you're using basically comes down to, is it valid and reliable? Okay, so you run your analyses on your data, and those are going to be your statistical results. Now you have to apply context and expertise to those results and form an interpretation. How do these results say something about what we've just done with this particular group within the proper context? So using published studies, doing a literature review, you see that our findings are in alignment with findings by other researchers, and you can kind of cite those studies again to kind of support your position for the interpretation that you made. Ensuring use and sharing lessons learned, use and dissemination of results. So basically, you want your results to inform the larger population. Those it's very similar when you're thinking about, well, how do I go about determining what type of program is needed, what needs to be done. Well, you're going to do a literature review. You're going to do your research to see, well, what have other people found in similar situations, and you're going to use that to inform your own decisions, program decisions that you're making. So you want to be able to give back and contribute to that current body of knowledge. So you need to think about, well, how am I going to do that? Okay, 4 standards of evaluation. So you have your utility standards. Are those that are using the results, getting the results that they need, right? So if someone has a purpose, a plan, well, I need to take these results back to my management team to see if we want to continue funding this program. Again, are you handing off results that would allow them to use the results to serve that purpose, right? If they have another purpose, does that affect, how you present the results and prepare the results? Okay, feasibility standards. It's easy to design a program or an evaluation plan on paper, but they have to be pragmatic. They have to be able to be implemented in a real world setting. So the feasibility standards of your evaluation plan, right? Can you get your hands on the data that would allow you to do the evaluation? Is it feasible? Does it involve accessing a protected population or protected data? Are you going to use an existing data set? Was there a cost associated with that? Is the cost way beyond what your funding allows you to do? So that again, once you come up with an evaluation plan, or while you're developing your evaluation plan, but you want to kind of keep these standards in mind. Propriety standards. Basically, this is ethical considerations. You're working with people. You're working with people's data. Since we're a health promotion discipline, you're probably going to be dealing with protected health information. You may be using assessments to collect data that are personal in nature. Again, are measures in place to protect that data from getting outside of the program and potentially, compromising the individuals that are participating in your program. And then accuracy standards. This just boils down to validity and reliability. If you're using an instrument that you found, and you have permission to use it, you want to go back and say, okay, how did they establish validity and reliability, if they even did that? If you're developing your own measurement instruments, okay, what are you doing to address validity and reliability, right? How can you demonstrate that the data collected by these instruments are worthwhile? They're they're not garbage. It's a lot easier said than done, but there are ways to establish validity and reliability. Okay, so here are some, I guess, I don't want to say common, but like recognized problems that can pop up during evaluation. So if we look at this first one, planners either fail to build evaluation in the planning process or do so too late. Some of the information that you want to collect, some of the data that you want to collect, needs to be done so in a timely manner. It's very difficult to go back in retrospect and get the data that you need for some evaluation decision that you make later on. Here's why. When you're selecting the data type, if you have the luxury of doing that, to go to use a parametric data, your interval or ratio types of data, because you can always go backwards and you can convert it to nominal or ordinal. But if you start off with nominal or ordinal, you cannot convert it to interval or ratio data. So again, really considering your evaluation methodology and plan, up front or in the beginning as you're developing your program plan. That's going to be the best approach. The neglect to do that, and a lot of people do this, it makes it difficult to evaluate data in a lot of cases. Okay, number two, adequate resources may not be available to conduct an appropriate evaluation. Yeah, these things cost money. They cost time. They cost personnel. And data collection is probably one of the most underappreciated aspects of program design and evaluation that's out there. Again, on paper, it's very easy to design an evaluation plan, but in practice, getting your hands on data, it's not always a given. Okay, organizational restrictions may prevent hiring consultants and contractors. So, if you're not well versed in evaluation, maybe the temptation is to, well, let's hire an outside firm to come in and do our evaluation plan for us. That's fine, again, if you have resources to do that. And there may be some restrictions on funding. Maybe the organization that's funding this project says, well, I'm funding you, not some other group. Why don't I just fund the other group to come in and do an evaluation? Right. So, again, you may want to know the rules that surround the situation so that you can operate within those rules. Effects are often hard to detect because changes are sometimes small, come slowly, or do not last. This is something with. All right, let's think back to the theory of planned behavior. And remember, theory of planned behavior has several constructs: attitude towards the behavior, subjective norm, perceived behavioral control. Those things interact to produce an intention to make a behavior change, which leads to a change in the behavior. Many studies that utilize theory of planned behavior, right, they can assess attitude towards the behavior in a timely manner, subjective norm, perceived behavioral control. All that stuff can be done up front, and you can ask questions. Do you intend to make a behavior change, right? And the person, yeah, I intend to do that. You may not have enough time to stick around to actually see if they make a behavior change. Or maybe there's an initial wave of individuals making a behavior change, but does it last, right? If they don't stick to it, they're not going to see the benefits, and then things start falling apart from there. So when you're doing your statistical analyses, yeah, you may have a statistically significant difference, but you need to look at your eta squared statistic to see your effect sizes. Sometimes these things are very small. Especially if we're comparing mean differences, right? There may be a statistically significant mean difference, but when someone that's not familiar with statistics looks at, the mean is 5.75, and the statistically significant comparison mean is 5.70. Right? The person may say, well, that's not a big numerical difference. It's not, but if it's statistically significant, then the difference is really there, but the layman may have a difficult time kind of consuming that. Length of time allotted for the program and its evaluation is not realistic. Especially if someone's determining, or the time frame's already been established before you were brought in to develop the program. Who knows how they came up with a timeline, and someone say, oh, well, evaluation, we'll give them a couple weeks. That might not be that's not a lot of time to sit down and really crunch numbers and do evaluations, interpret the results, write up a report. So that could be an issue. Restrictions may limit the collection of data among the priority population. Again, what type of data are you trying to collect? Is it personal health information? Is it information about certain opinions? Maybe you're asking some political questions, and maybe their employer has certain political views, and all that sort of thing. So again, things you need to consider, because they could be challenges when you sit down to actually do your data collection and the resultant evaluation. Number 7, it's difficult to make an association between cause and effect. Uncovering causal relationships, that's very difficult to do. For example, if you conducted a study, and in one part of your assessment you wanted to identify individuals that drink diet sodas, and you have other questions, and you ask about cardiovascular health, and you start to do an analyze, and you start to see, well, individuals that consume diet sodas seem to have fewer cardiovascular issues, or maybe they have more cardiovascular issues. Depending on how you set it up, it's very unlikely that you're in a position where you could say that the consumption of diet sodas, right, is what's causing the difference in cardiovascular health. right? Because there's a lot of things that can contribute to cardiovascular health. Um, so, you have to be, just cognizant of that, and especially if you are presenting results to an audience that may not realize that cause and effect is difficult to establish, and they may assume that there's a causal relationship when really that's not what's going on. So again, don't oversell what you're able to do with evaluation as far as cause and effect, but and you also have to be able to explain that most cases you're able to establish associations, not causality. Difficult to evaluate multi-strategy intervention. So here's the idea. So you're utilizing multiple strategies to achieve a particular outcome, and you know you want to be able to show some relationship between your intervention and the outcome. But the more strategies that you're utilizing, there's probably going to be a shared effect across the strategies. So your evaluation plan needs to be sophisticated enough to stratify those different effects. Many programs are evaluated, they're not that sophisticated, and multi-strategy interventions can often be problematic because you don't know which ones are actually contributing to the outcome, which ones maybe not so much. Discrepancies between professional standards and actual practice exist with regard to appropriate evaluation design. This is really where you may make assumptions. Right? You're working on a project. You've designed the project, and you start to make assumptions that, okay, well, everybody's going to follow these procedures as written, and they're all going to do it the same way. When the actual reality is that maybe some people are skipping some of the procedures. Maybe some people are not following the procedures exactly as intended. Well, that may impact how this intervention performs. Evaluators' motives to demonstrate success introduce bias. This could be intentional or unintentional. You expect things to work a certain way, and sometimes that can cloud your judgment when you go to make your interpretation of results. Stakeholders' perceptions of the evaluation's value may vary too drastically. Again, usually stakeholders probably aren't going to be on the same level of understanding evaluation and understanding how you arrived at these results and what these results actually mean or actually are saying about the relationships. And again, that can be problematic, but the onus is on you as the evaluator to be able to explain the results to your audience in a manner that's fitting of your audience. Intervention strategies are sometimes not delivered as intended or not culturally specific. That's process type stuff. So again, if you're not following your plan, or there's something that's happening that you didn't anticipate and you didn't plan for, well, the potential for it to impact your evaluation and your results, it's a reality. Okay, evaluation design must reflect the goals and objectives of the program. How do you do that? Well, you develop your goal and objectives, then you start to think about your evaluation plan, right? So they're always going to be linked together. Okay, the evaluation must be planned in the early stages of development and be in place before the program begins, right? So you've already worked out, okay, your measurable objectives. What data do you need? Where you're going to get that data? How you're going to analyze that data? And you start to think about, well, how would I interpret the results based on this, analysis or this evaluation plan that I have? Okay, baseline data, right? You want to show change. oftentimes we do that by showing change from when we started, or the baseline. So if you have objectives that again are set up to show a 50% improvement over baseline, well, you need to start thinking about, do I know the baseline? How was that data collected? Was it collected on a different group? Or, all that nature. So you need to think about that, but you're doing that up front, right? So you don't want to get started in your program and find out, well, gosh, I can't get my hands on the baseline data. Well, that's going to be problematic if you're trying to demonstrate a change from that baseline. Initial data regarding the program should be analyzed promptly to make any necessary adjustments to the program. So again, you want to start the evaluation during program implementation so that you can start to see how the results are coming in, which directions they're trending. If they're not trending in a direction that you think is necessary, can you go in and make some tweaks to get back on track to again give yourself the best chance at being successful. By creating the summative evaluation early in the planning process, planners can ensure that the results are less biased. That's kind of off the cuff. Ideally, you're controlling bias, but sometimes, okay, I'll agree with this. Okay, so you should have your evaluation plan developed up front, but sometimes during implementation you start to get more familiar with how things are working within the program. New information may come to light, and that's going to maybe cause you to reevaluate your plan and come up with different types of evaluation strategies later on. So I wouldn't say working or revising your summative evaluation plan during implementation is off the table. It's probably not something that's all that common, but it's reasonable and it's acceptable to kind of do those things. But I think what they're getting at is that you don't want to alter your evaluation plan to fit what the data are telling you, meaning that you just don't want to do some data mining and show, okay, hey, we're showing the program, the data indicates a successful program over here. Let's rewrite our evaluation plan to emphasize that area so that we can be successful to a particular group of stakeholders, because what they see as success may not be success in terms of the priority population seeing benefit. So just again, ethics and good judgment come into play here. Ethical considerations, you're always working with people, and you don't want to do anything to jeopardize participants' health status just because they're participating in your program. You just want to treat people as you'd want to be treated, and you don't want to put them in harm's way. If there are risks, no matter how small, you should be able to present that information to potential participants and allow them of their own free will, saying, look, here are the risks, and allow them to make a decision if they want to participate with this knowledge of risk. If they do, great. If they don't, well, that's their option. No individual have his or her personal information revealed in any setting or circumstance. Again, unless they kind of sign a waiver to do that. But in most cases, you're probably going to be presenting results at a group level or aggregated, and that in itself kind of protects personal information. But still, you want to have a plan as to how you're going to protect that information. And this last bullet here, talking about IRBs or institutional review boards, that's what they're looking at. These three things again. Does participation in this program cause harm? Okay, so they look through your protocol and check that. How are you gaining informed consent? How are you explaining the risk, if there are any, and again, establishing that they've been made aware of this, and but yet still agree to participate? And then how are you protecting the data that you collect? Well, IRBs are something are in place to kind of address these issues. All right, so conducting the evaluation. So typically, you're going to utilize internal evaluation. So someone internal to the organization that's delivering the program, they're the ones that are going to be the evaluators, right? So there's many advantages to this, mostly having to do with familiarity, understanding the context of the evaluation, being available and accessible to program administrators, and being able to make some changes on the fly if needed in the evaluation plan. It's just easier to work with individuals that are part of your program if they're the evaluators. Disadvantage they have listed here could result in bias. So the idea is that if you're part of the group and you want to evaluate the program and produce results that are are favorable to the group. Again, that's always possible, and that's always something that probably does occur to some extent. But again, you don't want to paint a picture that knowingly paint a picture that isn't reflective of what's actually going on. External evaluation, so bringing someone in to conduct the evaluation. The advantages here, fresh perspective, right? So they're coming in without blinders on or expecting some type of a particular direction of the results. Can ensure unbiased evaluation. Well, they're being paid to evaluate, right? I'm sure if you bring someone in, you're saying here's what we expect the program to do. They being unbiased, it's not a guarantee type of thing, but that's something that's thrown in here. Brings global knowledge, working in a variety of settings. Well, okay, that could be helpful. Brings more breadth and depth of technical expertise. So if you're bringing someone in to do the evaluation, chances are you don't have personnel available to conduct the evaluation. So that can certainly be an advantage. Disadvantage is more expensive. Again, depends on what the fees are. Can be somewhat isolated, often lacking knowledge of and experience with the program, and that make them less accessible. They may not, again, fully understand the context when you're making the interpretation of results. That could be an issue. Okay, so now you get your evaluation results. So who will receive the results of the evaluation? You got to know your target audience. If I were presenting evaluation results to a bunch of program designers, right, I'm going to present them differently than if I were presenting results to a general population. Again, depending on your audience, you can emphasize certain results over others. Again, this is after you have an understanding of what a particular audience values, kind of what they want to, or what they're interested in, what elements of the program they're interested in. And then planning for the evaluation should include a determination of how the results will be used, right? Of course. But kind of just a reflection on all of this. When I was doing my dissertation, I was using theory, plan, behavior, in looking at behaviors associated with following safety protocols within steel mini mill manufacturing facilities. And I was working with people from the human resources department that were the safety managers. And a lot of the dissertation project involved a lot of high-level statistical analyses. I utilized structural equation modeling. There was a lot of theoretical components. I utilized the theory of planned behavior and kind of wrote up this report reflective of those high level stats and the theoretical considerations. And I presented the report to the safety managers, and you know, a lot of feedback I got was, "What do I do with this?" Um, so I had to sit back down with the results and write them up in a way that were more practical from the safety manager standpoint as how to implement some changes that would result in better adherence to safety protocol. So um, totally different audience than my dissertation committee, right? They were interested in the stats and the theoretical components, not so much in the practical use. So being able to pivot and kind of uh, interpret results in different ways, again, to meet the needs of your target audience, that's something that you need to be able to do.